August. We launched the first meeting on June 10th, and we have archives of both the June 10th and the June 24th presentation on our website. For those of you that are new, I am Donna Wilson. I am a program director at NCSL's Children and Families program, and I'll be your host for today. And I'm also joined by my colleague Nina Williams-Bang, who is a senior fellow at NCSL's Children and Families program. And as I mentioned in the first session, children and families of color experience disparate outcomes when they're navigating through the child welfare system. And the pandemic, the subsequent economic downturn, and the national race relations crisis has further shed light on these disparities. And so we ask that you all keep that in mind throughout this discussion that we're having today. I also want to highlight that NCSL has collected more than 60 statements from legislators addressing issues around racism. And these statements offer guidance and insight into what legislative leaders are thinking on how they are reflecting on issues, and many policymakers believe issues that need to be addressed. So this also will be included in the resources that we'll send out at the end of this session. Before we get started, I just want to thank both Casey Family Programs and the Annie Foundation for their support of this project. And before we get started, I want to just do a little bit of housekeeping. At any time during this presentation, if you need help, we ask that you refer to the Zoom cheat sheet for tips. We sent that out before the meeting. And if by chance you inadvertently get yourself disconnected and you need to get back on, simply just use the link that you sign on in the first place. The other thing I need you to know is that we are documenting today's proceedings, and we're recording this meeting, and this recording will be available on NCSL's COVID-19 and child welfare page at the conclusion of this meeting. There is a chat box feature, and we do want to hear from you throughout the day, and so we ask you to please use the chat box to ask questions about today's presentation, or if you have other questions that you'd like NCSL to answer, please do that during this series. And we will be sure to answer those questions as we can, and anything that we can't get to today, we will make sure that we answer afterwards. So I also want to let you know what you can expect from today. And so today's session will consist of a panel discussion. We'll poll the audience with some questions because we do want to hear from you all. And then we'll have a short evaluation. I'm not sure I understand. Sorry, Siri's trying to get in on this conversation, you all. I apologize for that. And we also want to make sure that we hear from you all during the meeting. So what you can expect to learn are some critical issues that are facing foster families and kinship caregivers during this coronavirus pandemic. And we want you all to hear from several state efforts to ensure that foster families are safely continuing their work in caring for and nurturing children in their care. So we were hoping today to do something a little different for you and allow you the opportunity to hear from a foster parent directly about what they've experienced. But unfortunately, Darlene Bell, who was going to be our foster parent representative, who has fostered more than 30 children in her time that she and her husband have been fostering, she had a medical emergency and let us know this morning that she's unable to join us. So we are sending her our well wishes, and we are definitely going to miss her presence today, but just, keep her in your thoughts. Who you will hear from, however, are two state legislators. You will hear from Indiana Senator Ron Grooms. He is the chair of the Indiana Senate Family and Children's Services Committee. And you'll also hear from Minnesota Representative Rena Moran. She is the chair of the Minnesota House Health and Human Services Policy Committee. And you'll also hear from Jennifer Rodriguez from the Youth Law Center. Our structure today will begin with Jennifer giving us an overview of issues affecting foster and kinship parents during the COVID-19 pandemic. And she's going to do all that before joining our panelists in a brief discussion. We'll also conduct a short poll and take several questions from our audience and end with a wrap up, including a 2-minute evaluation from you all. So if you could just take a few minutes before you leave to fill that out, we would greatly appreciate that. So I want to just give you a little bit of information before we start. And, you know, in the midst of COVID-19 and the economic downturn and the shortage of foster parents, like this is something that has existed well before COVID-19, but the pandemic and all the issues that I just highlighted has really just made this, you know, acutely aware to us. And foster parents who have traditionally opened their homes and their hearts to children in the system have been faced with some additional challenges. And that's what we're going to discuss today. So we're asking you just to join NCSL as we hear about these issues and challenges that these families have faced as they continue to try to provide care for children in the midst of having a shortage of protective equipment, as they have you know, tried to coordinate safety and well-being for these children and provide for educational needs as well, all while, you know, trying to stay at home and, you know, follow the mandates on stay-at-home restrictions. So I want to give you a little bit of data. This is AVCAR's data from 2018, and, you know, as of that point in time, there were over 437 children in foster care. And of those kids, more than 125,000 of those children were waiting to be adopted. And the average length of stay in care was just under 20 months. And we also know that 23% of those children in care were Black children, although Black kids only make up 14% of the population. And I know folks have also asked about, well, what about, you know, Hispanic kids? And Hispanic kids, they are 25% of the population, yet they make up 21% of the population in foster care. So they are in the system, but they're not overrepresented as you see Black children are. And then lastly, 68% of the children in care are in non-relative placements. And that's really significant. And so as we talk today about you know, the issues that are facing both kin and foster parents, we want you just to keep those numbers in mind. So I am going to pause and turn things over to Jennifer Rodriguez so she can provide us with a brief overview. And as I mentioned before, if questions come up for you all while Jennifer is speaking, please, by all means, put those in the chat box because we want to respond to those during our time today. Jennifer, it's all yours.
Great. Thank you so much, Donna, and thanks everyone for spending your morning with us. My name is Jennifer Rodriguez, and I am the Executive Director of the Youth Law Center, and we're a national advocacy organization that focuses on transforming foster care and juvenile justice systems across the country. And I just want to start today by giving you a little bit of context for why this particular issue, whether foster parents and kinship caregivers have what they need during this pandemic and really during any time when our existing systems are strained, is so critical. In my opinion, foster parents and kinship caregivers are the single most important resource that we have to ensure that children and youth have their needs met in foster care, and that they're both protected from harm, but also that they're receiving all of the supports that they need to thrive. And despite the fact that I believe they're the single most important resource we have, we frequently leave them out of policy discussions when we're talking about what's necessary for reform. So I came to this conclusion both as an advocate. So my organization, the Youth Law Center, has been working on reforming foster care across the country now for over 4 decades. And we know a lot about the needs of foster parents and kinship caregivers because one of our child welfare system change strategies is our Quality Parenting Initiative, where we're working in 10 states and about 80 jurisdictions across the country to reorient systems around excellent parenting as the primary goal of foster care. And so in the course of that work, are talking with hundreds of foster parents across the country about what they're experiencing, what their needs are, and really what their recommendations are for change. So I'm really bummed that Darlene is not able to be with us today, but I'm going to try to do her justice by raising a couple of the points that I know she would want to share. But I would say more importantly, even than those two roles, I come to the position that foster parents and our kinship caregivers, that they're really the key intervention in our system, because I grew up in foster care myself as a child. And so I know what makes or breaks your experience and what's going to be a meaningful way to reform the system. Where you live is the single most important thing, and most specifically, who cares for you where you live, who loves you, who advocates for you, who takes care of you when you're sick, who's there for you when the world turns upside down. And I would say this pandemic has been a perfect example of the universe testing all of our limits on what it means for the world to actually turn upside down. When you really think about prioritizing and take action to prioritize the needs of our foster parents and kinship caregivers so that they can provide children and youth the excellent parenting that they need, it's the single most important way that you can plan for any crisis, for any unrest, for any challenge or difficulty that a child or youth may face in their life. It's the most important prevention plan that you can make for the worst days that a youth in foster care can face in their life, whether that worst day has to do with a pandemic, loss, heartbreak, police violence, or worse. And it's also the most important way to ensure that the best days in young people's lives are as joyful as they deserve to be. And in my own life, I'm exceedingly clear that I only survived the hardest days of my life after leaving foster care. Some of those hard days, more recent than not, with love, prayers, care, and grace of others who really had no reason to love me, but did anyway. And that's what our foster parents are doing every single day. And on the flip, what has made the best days of my life the best were the people that showed up as family to me, who showed me how to parent my own children, how to accept friendship and love, how to properly celebrate milestones and accomplishments. For our youth who are in foster care, there are going to be many of the best days and worst days of their life. I think this is just the beauty and heartache of life. But by doing this work of making sure that the people who care for our children and hold our children are cared for themselves and they have their needs met, we're preparing for all of those days and every day in between. So I want to be really clear. I see meeting the needs of our foster parents and relative caregivers as the most important emergency contingency plan that we can do, regardless of what the emergency is. I will start by saying that most of the COVID issues that have had the greatest impact on children, youth, birth families, foster families, kinship caregivers, and child welfare, they're not actually new issues. All of them were pre-existing cracks and fault lines, sometimes canyons that have now been amplified for everyone to see them. I think what the world has learned, or at least what our systems have learned, I don't know if it's spread really beyond our child welfare agencies, is that our ability to ensure that children and youth have their mental and physical well-being met, that they're able to make educational progress, that they are able to keep their relationships with their families of origin, including their birth families, their siblings, their extended families during the pandemic, relied almost completely on our foster parents and kinship caregivers because everything else stopped. So our children were relying on their foster parents to provide stability, to provide comfort, to meet their mental health needs, to provide connection to their family, to provide encouragement and meaning. And so while other systems suddenly realized that foster parents are key to helping families reunify, to managing visits between children and their birth families, to encouraging birth families and helping them to navigate difficult situations and stay on track for reunification, systems suddenly realized that the interest and support and involvement of foster parents is a critical part of them being able to do well in school and succeed in distance learning. When they suddenly realized that foster parents were responsible for ensuring that children stayed healthy, both physically and emotionally during this virus, they suddenly realized that And so they learned what is always true from the perspective of children and youth, which is that the quality of parenting and whether foster parents have what they need to provide that high quality parenting, that impacts every single element of their life and case plan. So that has become completely clear. So I know you're going to hear from a couple of our leaders who have been working in the legislature to ensure that the policies in place really focus on some of the areas, but I'm going to highlight just a couple of them for you before we turn it over to them. One area that has become extremely clear to systems that I believe that families would have told you has been important from the beginning of time is the capacity to hear directly from our foster families and relative caregivers about what their needs are. So just about every single system across the country panicked when the coronavirus hit, because they had no way of getting information directly from the people who were taking care of their kids around what their needs were. So for those systems who did have a mechanism, it was typically they had a few foster parents who they might have developed a relationship with, who might have done legislative advocacy, who perhaps participated in focus groups that they sort of turned to say, what do the hundreds and thousands of foster parents in our state, what do they need? And of course, that's no way to do a disaster response. So what has become clear is that our systems all need a way of being able to regularly, especially during times of crisis, but on a day-to-day basis, even in times of not crisis, to be able to hear directly from families about their needs. And I'll talk with you in a bit about some work we have done in QPI to use technology and pilot with a few systems ways of getting both individual information and aggregate information from families to identify what are the most pressing needs. Do families have financial needs as most pressing? Are they most in need of food delivery? Do they most need tutoring and support for their children who are in school? Are they struggling to be able to help children visit with their families and navigate the court closures, that kind of thing? That's one issue. A second issue is that families really need to be provided the best information that enables them to be able to do their work. In the Quality Parenting Initiative, we launched, starting week 2 in the pandemic, a series of trainings that was targeted at foster parents, relative caregivers, and birth parents across the country, bringing them experts in all of the issues that they were going to, that were new in the virus. So everything from how do you manage screen time for children during the pandemic when everything is on a screen, whether you're talking about telehealth or school or visitation with families. How do you develop relationships between birth parents and foster parents to be able to manage visitation when a jurisdiction may not have had the kind of policy in place that Representative Moran is going to talk with you about that introduces foster parents and birth parents immediately? How do you meet the needs of children's mental health needs when teenagers are isolated and don't have the opportunity to participate in the kind of activities that they did in the past, to have relationships with friends and to be at school succeeding when they're losing progress in school? So we brought these developmental experts on everything from navigating unemployment to dealing with accessing special education services to meeting kids' developmental needs directly. And we had about 10,000 foster parents and kinship caregivers and birth parents from across the country who signed up, participated in this 8-week training series. And their feedback was they had never had exposure to this kind of information or support previously, that this would be something that would typically be reserved for the professionals in the system. So giving foster parents the information that they need to do this work, really empowering them with the tools, is critical. The third area that I want to highlight for you all is that relationships, ensuring that your system has policies and practices in place that support relationships between birth families and foster families, is critical. During the pandemic, what happened is For those foster families who didn't, where a system hadn't already facilitated them working with the birth family, they were left on their own to do that work. If children were going to have any visitation at all, if there was going to be contact, they had to actually work directly with the birth family to make that work. That works so much smoother in jurisdictions like in Minnesota, where there had already been a lot of leadership to put practices in place like comfort calls at sort of the administrative level, and where there was already system changes that were in place to do everything from encourage participation in visitation by foster parents and birth parents, to ensure that that is part of the case plan for children, how families will be co-parenting and working together, that courts are on board with that. So we have a couple of examples. Representative Moran, like I mentioned, will talk with you about some legislation. We also worked on legislation in Florida, HB 1105. I'll put some information in the chat that now requires those kind of—
Jennifer,
Yes.
before you review that legislation, can I just have you like sum it up so we can introduce the other two panelists? And because you're giving us so much information, I just want to make sure that everybody has some time, and then we can get these questions moving.
Yeah, absolutely. And I won't, I'll put information in the chat for folks so that you can
Perfect.
read on the bill, but I will just stop right there and say that what we have learned during the pandemic is that we need to do a much better job of hearing from our foster parents, of enabling them to meet the needs, and of ensuring that the people that are most connected to children and love them the most are supported and working together.
Thank you so much. You gave us lots of information. I really appreciate hearing the fact that you are a former foster youth, and so you have some personal knowledge and experience around this issue. Thank you so much. And we're going to come back to you. I have tons of questions I've written down, and we also have some in our, that we've already pre-populated for you. So I'm gonna introduce, not me introduce, but I'm going to invite both Senator Grooms and Representative Moran to unmute themselves. And perhaps we could just start with Senator Grooms, and he can tell us briefly, you could just introduce yourself briefly and share your connection to the topic that we're discussing today. So if both of you could just do that for me quickly, then I'll have a series of questions for you all. And just to let the audience know, we're doing something a little different. We're doing this talk show host, type format. And so welcome to the NCSL talk show. Senator Grooms, it's on you.
Thank you, Donna. Thank you to your staff and NCSL for arranging this panel and arranging this meeting. A very important subject, as you know, particularly in the wake of the COVID-19.
Where did I do?
My name is Ron Grooms. I serve in the Indiana State Senate. This is completing my 10th year in the State Senate. I serve as chairperson of the Family and Children's Services Committee in the Senate. And I also serve on Policy Committee, Intergovernment Relations, Elections, and Commerce and Economic Development. Those are some of the committees I serve on. The state of Indiana, since March the 6th, has been under a primarily responding to the COVID virus issue with the executive orders by the Governor Holcomb. On March the 11th, I believe it was, we adjourned for the year. So we're not in session right now and will not be in session until about the first Wednesday of January of 2021. There has been no legislation obviously passed since we have not been in session. We will have interim study committees this summer, and one of them is the issue of foster care, and with those meetings have yet to be scheduled. Part of the leadership team in the state that has helped Governor Holcomb with the administration includes the commissioner of the Department of Health. The Indiana State Department of Health has been charged with carrying out the emergency plan and the reaction for the state to the COVID virus issue. They are being assisted by the Workforce Development Program, the Secretary of State FSSA, which is Family and Social Services Administration, the Department of Child Services, we call DCS, the Commissioner of the State Police, Budget Director, Education Chairperson, and others have formed an advisory committee that advises the governor on executive orders and other businesses that the state has done. The governor has issued over 15 executive orders since March the 6th to address the COVID situation. Some of the things that Indiana has done recently is include in legislation in 2018 a foster care bill of rights, foster parents bill of rights. We dealt with an issue last year regarding background checks for workers in a home health care area that deal with foster care and other agencies dealing with adoptions, etc. The bill ran into a little bit of a stumbling block and did not pass because of one of the regulations regarding out-of-state background checks. I think we've worked that out and we'll probably be able to pass that bill next year. Indiana's annual budget is about $16 billion. We're going to get about $2.5 billion, I believe it is, $2,442,000 in direct relief from the federal government for the COVID virus relief fund. 400 million of that will go directly to children in FSSA and foster care. So we do have money set aside to pay for many of the expenses, including, as you know, the PPE and the other expenses that have been incurred. I had a phone conversation, and this is the heart of probably I want to relay today. Yesterday or day before with a director of a provider, provides foster care, adoption services, etc. And when asked upon his answer to my question was, the major issue with COVID has been what? And he said, emotional anxiety in the workforce and in the parents and the children. As you know, the workforce is pretty much 24/7. The workforce for child care and foster care never ends. Their particular business or provider has had no quarantines yet. The issue also is complicated this year because Indiana basically canceled school about March the 15th, but we have had what's e-learning or video lessons that teachers have been responsible for. So this has been quite a disruption to the typical foster care family. All of a sudden, the kids are home, the mother or father are no longer working, so you have this environment that you normally don't have, and that's created, as you know, a lot of stress. The PPE, of course, increase in wages, most of the work that's being done that was in person and door to door and in the home is now being done by video conferencing, Zoom, and other technology sources. So that's a real quick overview. I'd be glad to go into some of the other issues that we're facing, but one is the anxiety level, the confusion, the fear, and then of course making sure that the healthcare workers are taken care of, and making sure that number one, safety, of course, is always the biggest issue when you're dealing with disease such as this. My background is a pharmacist. I had a pharmacy owner, and over almost 40 years as a pharmacy owner. So I have some background in the healthcare arena, which helps with this issue a lot.
Sure.
Having been through the 2008 and 9 flu season.
Thank you, Senator Grooms. We are going to come back to you. I'm going to turn it over to Rep. Moran and again, just ask, to briefly introduce yourself and share with us the connection that you have to this topic that we're discussing today. And then I have a series of questions I want to pose to all of you. You've sort of given me a little bit of the answer, Senator Grooms, but we'll come back to you in just a sec. Representative Moran.
Well, good afternoon, everyone. And I would do a short introduction. Just want to say, Jennifer, thank you for that great introduction and your sharing of being a product of the foster care system. So again, my name is Rena Moran. I'm a state representative. I have been in the House of Representatives. I am completing my 10th year in the House of Representatives. For the last 10 years, I came to work for a nonprofit called Prevent Child Abuse Minnesota. And as part of that organization, my job was the director of parent leadership. So for transparency's sake, I want you to know that I am a huge parent advocate who really believe in the foundation of family. I have had the privilege over this last biennium to be the chair of the Health and Human Service Policy Committee and to work my way through all that encompasses. A part of what my passion is really to look at my work through a prevention lens. I am very engaged in trauma-informed policies and practice. Am a partial training of ACEs, which is Adverse Childhood Experiences, recognizing that we're all a product of our childhood. And so the work that I am doing around the child welfare system, foster care, out-of-home displacement, really found me. I didn't find it. It was through my work in the nonprofit of working with parents through Prevent Child Abuse Minnesota, that all the parents that I was working with had some type of impact or encounter with the child welfare system, whether or not they were a product of that system themselves, whether they have had encounters with the system themselves, or was a foster parent, or had some type of connection with that child welfare system. And through that, I really got vested in communities and families and parents to believe that, and I may be on a different spectrum, you guys, so bear with me, of recognizing and valuing the support often that parents need and family needs. And if we were a state that could invest in a bigger way, and often the ways that we invest in foster parents to give parents the tools that they need to be the best parent that they can be, that we can also help keep kids in our homes, and that we can make the priority of reunification a priority of getting kids back home, if not with their mother or their fathers, then with kinship care, with family, because family is important. So a lot of my work that I do and that we have moved to do in the state of Minnesota is looking at the removal of kids through the lens of first priority is about reunification, if at all possible, and helping parents to navigate a huge system that is kind of like innately impossible to navigate by themselves. So we also invested dollars and resources to help families navigate the court system, to navigate their responsibilities and what they need to do in order to get reunified with their child or their children. And I would stop there unless you want me to go into some policies right now that I would
Not
stop
yet.
there.
I'm gonna ask the question. I mean, you guys are giving me so much information. I don't feel like I'm doing my job as the talk show host here, but this has been great. I guess the first thing that I want to ask you all, and I'm trying to be cognizant of the time and, all these questions and information that we want to get from you all, is you all hit on a couple different things. I mean, the first thing is that I know is that there is no national data that really gives us an accurate count of the number of foster parents that we have in our system and what their needs are. So that's the first thing I just want to highlight. But I'm curious if the legislators can particularly tell us, has COVID-19 or how has COVID-19 impacted your ability to recruit or maintain the current foster homes that you have?
Yeah.
I'll go first.
Okay.
My phone interview led me to believe that there in Indiana, the supply of labor force in the workforce is adequate right now to handle the load and the extra duties and the extra burdens that have been put on the providers because of the COVID-19. His comment was that they seem in Indiana, it seems like when the situations like this arise, we have a dedicated group of healthcare professionals that actually want to get more involved in childcare and helping, whereas they may go on to another job just simply for maybe $1 or 50 cents an hour. But his response was that the workforce is there if they're made comfortable, if they feel safe, if they feel like they're being adequately compensated, a fair wage. There's workforce there in Indiana to help with the extra burden of treating the patient, as well as controlling I guess you'd say, the environment in which the worker has to work under.
Okay. What do you see in your state, Representative Moran? Thank you, Senator Grooms.
Yeah, so first I just want to say, even before COVID-19, we were struggling with foster care. In 2014, we moved some legislation that really began to remove kids at higher numbers from their home. And so what we found was that foster parents, foster parents were overburdened with this influx of kids into a system, right, where they wasn't quite prepared for, because also with a system where foster parents, the kids come with special needs and special various, issues and concerns that they know nothing about. So we also found that, often foster parents were being traumatized themselves because they was doing something they love to do. They were being, they felt like it was just too much for them to handle at one time. So on top of that, now we have COVID-19, which we have, which we're trying to still keep the priority where we want, parents to be able to go to court, to navigate the system for the purpose of reunification. But that has kind of like pretty much for a while had just completely stopped. Mm-hmm. We were not having any court hearings at all. Mm-hmm. In the beginning, trying to make that connection and see what was the right measure of numbers of times that foster parents can engage with birth parents, or where with kids can have a conversation with their parents, were like at an all-time high, because this was something that was new to and for us that we wasn't quite aware of. But okay. I do know that currently now that the courts are back up. They're not they're not engaging at the rate that they had before COVID-19, but all of those court hearings now, as the senator from Indiana talked about, are through Zoom or video currently.
Okay. And I guess the question before we go on to the next segment of our program is I'm curious, and Jennifer, if you have some insight on this, please feel free to jump in, but what effective strategies have you seen your states implement in order to support foster and kinship caregivers during COVID-19?
Well, I'll start. So it's been really hectic for me as a legislator, right? So let me just be transparent to say that I have not had the luxury of having like really good conversation with foster parents. So I had to make a couple of phone calls to talk to those who are directly engaged with families in the foster care system. And so what I hear from them is that it's been really hard. It's been really challenging. Everything, foster parents don't really feel comfortable like having birth parents, although visitation take place in their homes. It's been a challenge to find a neutral space where they can go and also meet with the birth parents, so the birth parent can have visitation with their child, because we know that we still have to social distance. And so that is just a concern, it's a fear, and it's just a reality of where we are in the midst of COVID-19. So there are still those challenges there right now under COVID-19 with the visitation rights, how often they take place, can they take place? So again, those visitations are taking place through Zoom and video and phone calls.
So one of the strategies that you all have used is to implement the virtual visit.
Yes,
okay. All right.
Absolutely.
Senator Grooms or Jennifer, do you all have anything else to add before we sort of shift gears a little bit?
Just the ditto the representative from Minnesota. I'm sorry if I don't remember your name. The virtual visits is very important and has been a lifesaver almost for continuing the care.
Okay, thank you. Thank you. Jennifer, did you want to add something?
I might add that a lot of foster parents have really stepped up and have communicated very well with Department of Child Services and the various agencies that deal with foster care and in out of home placement as well as in home. So the parents have come forward. That's what I'm being told.
Okay, all right.
They're being heard.
Thank you.
So if I could just add a few things that I think California has done well, have been one, to put out state agency policy that requires stability and gave guidance to foster parents around what to do if there was a COVID exposure or positive in their home. And so the state policy basically made it very, very clear that children were not to be removed, that stability was the priority, and that families were instructed to follow the same CDC guidance that all families are following. If either a relative caregiver or a foster parent or a child were either exposed or positive. And this was critical because the first instinct of the system when this started was to remove a child if either a family or a child was positive, and it was creating a lot of disruption and also starting to move the system towards putting children in congregate care facilities, which I know you will hear about in your next session. But we had counties across California who were starting to want to use wings of shelters to create sort of makeshift, there is now use of trailers to house children. So people panicked. I mean, that's the bottom line. So having the state agency immediately respond by issuing that guidance was one thing that was important. We also had executive orders that allowed for some additional funds and resources, like an additional food payment to be accessed by both foster parents and birth parents, which was key. We also had guidance that went out on testing, which I also think was important because there was also an initial sort of flurry of, should we subject every single child in foster care to testing and their birth parents? Where we know that's it's an invasive test. It's not, you have to wait a while for the results. It's only accurate at that minute in time. So having somebody, and it needed to be our state administrative agency because of needing to expedite it. But part of what we've been trying to talk with the legislature in California about is it's really important that we get some procedures in place right now that don't rely on the administrative agency needing to act, but are actually in policy, because now we have learned a lot from this experience that we could actually enact so that we're ready to go if something like this happens again.
Yeah, thank you all for that. I want to turn it over really quick to my colleague Nina, because we want to hear from our audience. We want to know what they have faced in their respective states, in their jurisdictions. So Nina, I'm going to hand it over to you quickly. You're muted, Nina. We can't hear you.
Great. I'm sorry, I'm muted. We have a poll, as you can see. I will read the polling question. What has been the biggest challenge for foster and kinship caregivers in your states during the pandemic? Please select one. I will read them. Managing visitation between children, biological families, and caseworkers. Handling homeschooling. Training to address needs and concerns related to COVID-19. Safely coordinating children's medical needs. Addressing caregivers, that's the foster parent and the kinship caregiver, their health and other needs. I will give you just a minute to go ahead and respond. And I believe you all can see the responses that are coming in. It looks like 67% of respondents, 60% managing visitation between children, biological families, and caseworkers is the largest concern, followed by handling homeschooling, followed by addressing caregivers' health and other needs at about 10%, and finally, a need for training regarding needs and concerns related to COVID-19, coming in at 10%. Thank you, everyone, for your responses.
Thank you, Nina, for capturing those responses from our audience. I'm gonna turn it back over to you again. So I guess you're still in control of the time here, Nina.
Okay.
A few questions, excuse me, to our legislators.
Sure. Thank you so much, Donna. And this question again is for both Senator Grooms and Representative Moran. You've answered this a little bit. Can you talk to us about policy reforms that your states have implemented to support foster and kinship parents in general and during the pandemic, or anything that you think has recently been enacted that has been particularly helpful so far during the pandemic?
Moran, would you like to go first?
Sure, I can go first. So as we know, the pandemic hit us in closely like in March of 2020, as we was in the midst of a regular session where everything shut down, right? Every bill that was on the docket got moved away so that we can focus on COVID-19. And quite honestly, in regards to foster care, we did not or have not that I know of. And I have not heard at the state county level. This is really where it impacts, counties. And I try to do a lot to focus around the county that I represent in the legislature. So what I do know is that the focus has been really on trying to maintain or create those spaces where we can have those meaningful visitations take place between the birth parents and the children who are in foster care, as long as their parental rights have not been, lost. That has been the biggest challenge at the county level, to try to make sure they are maintaining that parents are very much informed around COVID-19, because it's something that's brand new, and what it looks like and what we need to do is forever changing and always changing. And I think the third has been a challenge, like it is for most of us who are parents, is homeschooling. If you have 2 or 3 or 4 different kids, in your home, and now you have to do homeschooling, and through distant learning, that is just taking you to a whole different arena, and has been very, very challenging for whether they're kinship providers or foster care providers. Those are the things that I've been hearing from my state and from my county.
Thank you. I believe the question dealt with housing. Was that part of the question, Nina?
Well, yeah, that could be. The question dealt with what kind of recent reforms to support foster parents and kinship caregivers perhaps the state has already enacted that has been particularly helpful during COVID-19, or anything that you've been able to get in place or work on during the session, or what's been left of the session.
The availability of PPE supplies has dramatically improved tremendously in Indiana. It is now an issue. It started out as a marketplace source, and now it is the providers can go directly to the manufacturer supplier and buy direct. The pay is increased for an average of $1.50 an hour, so I'm told, for the average healthcare worker in the field. The technology, the virtual visitations, the Indiana has not adjusted the per diem for foster care, and I'm told probably will not at this time until there's more information. We have over 40 some residential providers for foster kids in Indiana, and all of those are busy, and most of them will tell you that it's the busiest year they've had in 2 or 3 years. Indiana's out-of-home placement is actually down approximately 1,000 per year since 2018. So we haven't had the crunch yet as a result of the COVID, from a massive increase in the number of foster kids in out-of-home placement. So the issue, of course, is now you have mom or dad at home. They've laid off. the child is not in school, the child is learning at home. You have to figure out how to make that home safe. You have to figure out so that the care workers are not afraid to go in. Just all kinds of challenges in that area, but safety is the big issue, and the cost to the residential providers to provide a secure environment for a family to come and visit a child, where you have the social distancing, you have to washing the hands, you have separate room often for just that visitation, and that's become a burden and the state has relaxed a lot of those rules, I'm told, so that as long as they're safe, that's fine. We'll worry about the rest of the 5 feet versus 6 feet later.
So I always think we have like this abundance of time when we start, right? And that I knew this was going to happen. I knew we were going to have such rich conversation that we would probably run out of time, and we're getting close to that moment. So I just want to pose one of the questions that we've had come through from our audience, which is, has the absence of face-to-face meetings due to COVID-19 increased the risk of agency workers not being able to pick up on signs a foster child may be in distress for reasons such as not being treated or being abused? And so, you know, Jennifer, I know you haven't had much airtime. I don't know if you have anything that you want to add on that, and then I'm gonna turn it over to Nina once you are done with that.
Yeah, one of the things that we advocated for strongly with the agency initially that they adopted is that as long as we're doing virtual visits, that we need to really change the way we're doing visitation. So with social workers who are visiting children, we're advocating for much more frequent contact with children. Okay. So rather than once a month visitation, we're asking workers to be checking in a couple times a week. Now that they don't have the additional travel, and to really be asking, one of the things that you'll see, the policy investments that California made was ensuring that all families and children and youth in care had access to technology to allow them to do the virtual visits. So, you know, being really creative and saying, can you show me around the room? Can you take your phone outside and talk? And I want to mention the same thing is true around the frequency of visitation between birth families and their children. So we've also been working with courts to say, look, a good court order now for visitation involves being able to ask foster parents to be doing daily virtual contacts between the birth family and the child, to include them and put the iPad at the dinner table. So that mom can have dinner with the family and with her child. There, when the young person is playing video games, set up the phone on the side of the room so that dad can hang out and be a part of what's going on in the household. This is an example of something that I hope that we will keep as we transition back to in-person visitation. I hope we still keep the regular and frequent virtual contacts as well. And that's true for social workers too. The more contact, the better. I mean, we've had young people who have said for a long time that the monthly drive-by visit, even when it wasn't in person, not adequate.
Yeah. Thank you for that. I'm gonna turn it over to Nina just to make sure that we do have time to do justice. I will encourage our audience, if you have additional questions that you weren't able to ask to any of our panelists, or anything specific from NCSL, please send that to us and we will make sure that we circle back with you all. So Nina, I'm gonna turn it over to you.
Okay, thank you, Donna. Yes, definitely. This is a list of NCSL resources that everyone is welcome to access. We have informational briefing papers on child welfare and COVID-19. We've got 2 web pages with charts of legislation, 50 state legislation related to supporting foster parents and supporting kinship caregivers that we think that you'll find helpful. And we have human services and our COVID-19 resources. Other resources outside of NCSL are here as well. Grandfamilies.org has a COVID-19 resource page. Generations United, which works with grandparent caregivers, also has a COVID-19 resource page. And the Federal Children's Bureau, we refer to data from their Adoption and Foster Care Analysis Reporting System, or AFCARS. And 2018 is the latest data, and there's a link that you see here. Again, I would like to thank all of our presenters for the information that you provided to us. And please, everyone, contact us if you want more information on some of the policies that were discussed today. We want to remind everyone that our next presentation is Wednesday, July 29, COVID-19 Child Welfare Placements in an Uncertain Time. That will be at 2 p.m. Eastern. Any questions, please contact us. And we should be seeing our evaluation in just a moment. Please take a few moments to fill these questions out. There are only 10. We appreciate your help. Yes, and the PowerPoint that you saw, as well as the entire presentation, will be archived on our website within the next few days. We will be sure to send you a link to that. This has been quite, yes.
Go ahead, Nina.
I was just going to say, this has just been quite helpful and just reiterated to us the fact that visitation, availability of supplies, and homeschooling are some of the top issues definitely facing foster and kinship caregivers. So it's been really helpful to hear how this is playing out in a couple of different jurisdictions.
Yeah. Thank you to each of the panelists. And again, if you all could just take a few moments to fill out the evaluation before you leave. It's live. You can do it in real time. 10 short questions. We really appreciate your feedback. Thank you all for joining us this afternoon. And Representative Moran, Senator Grooms, Jennifer Rodriguez, thank you all so very much. We are very appreciative of your time and your information that you shared.
Well, thank you too. Not enough time. Bye. Are we standing by?
Yes, ma'am. You are free to go. We're just hanging out for
Okay.
evaluation. Thank you for asking, though.
All right. Take care.
Take good care. Bye-bye. Team, do we think we have all of the responses collected?
No, give me 1 second. I'm taking clippings of them right now.
Oh, okay. All right. I just don't want to end the meeting if people are still taking the eval. And maybe we can just hang out for a few seconds after everybody is gone. I think it's just us left, right?
Yeah, just give me 1 second though.
Yeah, that's fine. I just wanted to remove the folks that were still kind of hanging on.
Oh, okay, gotcha. Yeah, I think that's fine.
Donna, I don't know if you saw, but Raquel was asking if you had a few minutes to talk.
No, I didn't see that.
You are in the meeting now. There are 8 participants.
And she wanted to talk to me in particular?
Yeah, she said, I'm with Senator Montgomery's office, chair of Children and Families, and would like to know if I could speak with Donna briefly if she's any availability.
Oh, no, I totally did not see that. We
What she
have
said-
her
was that
contact
a flush?
information.
Sorry.
What, Nina?
No, I was just commenting the same thing. I saw her say the beginning of it, but I didn't see that she wanted to speak with anyone.
Yeah, no, I didn't see that. Shannon, if you can dig out her email information, I'll send her an email. Ow.
I don't know how accurate these polls are because people rated Darlene Bell as like 20%.
Did they really? Was she great at least?
They said most of them said she was good. Some said she was satisfactory, and some said she was.
That's great. And I didn't even think to.
That's
Should we
funny.
end the
Yeah,
poll now, Gerard?
Nope.
Okay.
Almost done. Almost done.
No, oh, that's fine. I didn't even think to edit her out of the poll.
No.
I didn't even think to catch.
I did. But I was like, it's a little too short notice. So
Yeah.
It didn't occur to me that people would fill it in.
I have to do them one at a time just because they all don't fit, unfortunately. But I'm on the last two.
Okay.
Okay, we're good.
We're good.
Yep.
All right. So I don't know what it is, but I thought we were going to have all this additional time, and time so fast. Like we didn't get through half of what we thought we could get through.
Yeah.
Well,
I mean, legislators like to talk a lot, and you can
Yeah.
ask them to be brief, but they're not going to. So.
right.
I also think Senator Grooms was thinking that he was just launching in his spiel as opposed
Yeah.
to just
Yeah.
doing his intro. So.
Right. Yeah.